So we have at the Schaefer Center for Health Policy and Economics, like the University of Southern California, a fairly new multi-year project that's supported by the National Institutes on Aging to produce national estimates of the cost of dementia. And these cost estimates will be longitudinal and importantly, reproducible. We have just released our estimates for the cost of dementia in the US for 2025. There's also another goal of this project, and that is to build research infrastructure to expand research in the field of dementia. So we know that the costs are high, we know that they're growing, and there are also myriad opportunities for solutions to reduce the cost for individuals and families, for healthcare systems and payers. But we need more researchers in the field to help us identify these opportunities and move the field forward. So we have what I call three general buckets of costs. So the first is what people are most familiar with, which is the medical and long-term care costs. The second bucket is the costs of all of that care that's provided to persons living with dementia by their families and friends, that is unpaid care. And also the impact of that care that they're providing potentially on their work and on their earnings. And then in that final bucket are the costs associated with the loss and the quality of life due to living with dementia, living with the disease, and potentially on the lives of their caregivers and care partners. Those are great questions. So as I mentioned, we have just produced our first estimate for 2025 of the cost of dementia for the US. And the total cost is $781 billion. So that's a B for billion. It's a very large number. So if you think about it in terms of the gross domestic product of states in the US, it's like the 14th largest state, Michigan. That's the size of this number. That number, if we begin to break it down and think about of those three buckets, how much of those buckets each of those costs are filling, the largest portion of that cost is due to quality of quality of life loss for persons with dementia. And that's about 300 billion of that 781 billion. The second really big bucket is the value of all those hours of care that's provided by family and friends, and that's around 230 billion. And it's about the same as the cost of medical care and long-term care costs, another about 230 billion. So those unpaid hours is about the same as all of those medical care hours that we hear much more about. And then that's followed by the foregone earnings of care partners and caregivers and the quality of life loss for the care partners, another 8 and 6 billion. And then about thinking about how we understand how these costs may change over time. So one of the strengths of this modeling approach and what we've developed is to be able to quantify how the costs are changing and what's the drivers of these changes, to understand which interventions might not only be effective, but also who will they impact? What kinds of costs will they increase and decrease, and who will be bearing those costs? So if we think about prevention, better prevention, that will likely decrease costs. But then what we've seen in the last decade is a lot of innovation, and we've seen a lot of innovation in novel therapies. These tend to increase medical care costs, and the cost of the drugs tend to be very high. And that gets a lot of attention. But the therapies, because of their impact on slowing cognitive decline, will also likely improve the quality of life of persons living with dementia, quality of life of their caregivers and care partners, and potentially compress those years of severe disability into a shorter time period and really reducing those costs. So ultimately, the value of those novel therapies is potentially very high to individuals and their families and society, despite their high price tag. The other area in which we plan to in the future put some numbers around in order to understand better is the new care models. So we have new care models. How can we better take care of persons with dementia? How can we better support caregivers? And this model has the ability to not only give us the answer to that, but also compare across different models. So there's a lot of models out there. We hear about Guide and others. So how do those compare? How are they not only being effective in providing better care, but what is the impact on costs? And who is bearing them? Are they transferring costs from individuals to the healthcare system or vice versa? So these are the kinds of insights that we hope to gain as we move forward in this multi-year project.